This is brought to you by the Kansas City Business Association, located at 1601 East 18th Street, Suite 200F. What's up, Kansas City? This is Tiffany Berry, and today my guest is Miss Merlon Ragland. How are you today, Miss Ragland?
I'm doing fine, and you?
I'm doing good. Thank you for asking. So today we're just going to ask you to introduce yourself to our audience and tell us a little bit about Gifted Hands, Talented Minds.
Okay, my name is Merlon Ragland, as Tiffany has stated, and I created a non-for-profit back in 1999 called Gifted Hands, Talented Minds, and I did that to have more exposure and assistance with my daycare. So in creating that business, I was able to have people to come and volunteer as tutors, and I also opened a daycare that was able to assist children
That's
with their
awesome.
business.
Great. Okay, so if you don't mind telling us, like, what services does Talented Hands, Talented Minds, Gifted Hands, what does that offer?
Gifted Hands, Talented Minds. Basically, we offer, right now, I utilize the non-for-profit in doing birth work.
Okay.
So we are a perinatal service, and we offer prenatal care to women. And I'm a doula, and a doula is a non-medical assistant that helps women with prenatal service, labor and delivery, and postpartum care. And I was certified through the Uzazi Village, which is at 3647 Troost. And through that, I also created a support group that also works with prenatal women and also new moms, so that they will have the support and the assistance that they need, so that they won't feel like they're isolated and don't have anyone there to help them.
Absolutely.
So, and through that, I also created a support program that I do through baby showers. So I have 3 baby showers a year, have one in August, and I do one in December and in April.
Okay.
And I just had my first one this past August. So, and it did really well, being its first baby shower, and we did get a lot of new moms there. They asked a lot of questions, mainly around breastfeeding, because I did have someone there that could talk to them about breastfeeding. Because in the Black community, it's kind of like something that women don't want to do, and they tend to want to be more promote formula, more so. So we're trying to get women to be encouraged to do the more natural milk and the more natural process,
Yes.
which is breastfeeding.
All right, awesome. So now, as far as your focus, your focus of support, does it go towards the Black community, the Black moms, the young moms?
Basically, that's our main goal, is to bring more awareness to women of color, and especially Black women in our urban communities, because the Black women in our urban communities are suffering more during pregnancy. They tend to not have as much support as needed.
Yes.
They don't have as much information as needed about pregnancy and the things that they should go in and be asking their physicians or their midwives. A lot of the women that I work with are high-risk women, so they might have a lot of different ailments, as high blood pressure, diabetes, and we want women to get the best help that they can with those types of illnesses. So as a doula, I would go into their homes and sit with them. We usually do an hour per session, unless they might need more, but I usually stay at their home for an hour and give them information kind of circling around what their interests are, what they are interested in, and what their needs are. So basically, each case is different. Each person is dealt with as an individual as I work with the client. And I work with the client up until 6 weeks postpartum. And I stay the whole time of their labor and delivery process up until an hour after. So a lot of times you do have family members that go with you during your labor and delivery but a lot of people aren't really like have a lot of knowledge about
Yeah.
labor or birth
Mhm.
or just the hospital setting itself. They
Right.
are there to basically be there, and a lot of times they're not actively involved.
Mhm.
So you really are needing someone to be actively involved in supporting you, and that tends to cut down on uh, the like preterm labor
Mhm.
or a lot of things that could happen during birth. You
Yes.
might sometimes you can have issues with like say like if you have high blood pressure. A lot of times if you have a doula or someone there that can support you, they would know like the different comfort measures to do for you. Maybe like moving you around instead of letting you lay on one side. A lot of times the nurses are very busy. They don't have time to stay one on one with you in
Right.
the room. So if you have somebody there that can keep you to remain focused,
Mhm.
teach you the proper breathing techniques, you tend to have a more successful outcome.
Absolutely.
And because we are trying to promote more vaginal birth deliveries instead of them having to have surgery
Great. Well,
so that they can heal
that's
quicker.
good, Ms. Ragland. I'm pretty sure the young ladies or the women that you help are really appreciative of that. So we thank you for that. Now, one thing I do want to tap on, go ahead on, is your baby shower. We did discuss that, but like, what consists of your baby shower? Like, how many women actually attend the baby showers?
Well, this was my first baby shower I've done. So we had about 12 women that came to the baby shower. Not everyone was pregnant. So we had a lot of support people that were there. We had a few ladies that were there from the WIC office. There was a breastfeeding counselor present. There were also like women who have had children before can be great mentors. So they had the women that were pregnant had a lot of people to bounce questions off of, to ask them certain things. And you could get professional and non-professional answers.
Okay.
Basically just people who have just been there as a mom. You
Yes.
have people who breastfeeding counselor is for say that's her profession, so she does it daily, working with women who are encouraged to breastfeed, to keep them, encouraged, to keep them motivated, and to keep them with as much information as possible so that they can have a successful breastfeeding period. We tend to want women to at least breastfeed out to 6 months.
Yes.
Hopefully you can breastfeed longer, and if you can probably breastfeed 6 months, you can keep going. A lot of women tend to not want to breastfeed because they have to go back to work, because a lot of jobs aren't breastfeeding friendly. A lot of daycares aren't breastfeeding friendly. So we're trying to get the information out in our community so
Yes.
that our breastfeeding numbers can go up. And we're also trying to get the information out to our communities so that our labor and delivery can be more successful. So we will not have as much, so our infant mortality rate will be lower.
Yes.
Because right now we have the highest compared to our white counterparts. So we're 2 times more likely to die as women in labor, and also the babies as well. And also with stillbirths, a lot of more SIDS, infant deaths, once they get home. So we're tending to, and in baby showers, we can use that as a platform, at least I do, use that as a platform to be able to talk to women,
Yeah, that's great.
to get them that information out.
Good. So now, not only do you offer a service, it's not a service, it's more like a open arms family, should I say. So, you're getting real intimate and real personal with these women. So, so it's basically like a family basically.
Right.
Let them know that, hey, I'm here to comfort you, I'm here to give you advice, I'm here to educate you on these things. So my next question is, what is your overall motivation or inspiration to do what you do with your organization?
Well, what motivates me the most is I know that every woman has power. And a lot of women now that I see, they keep it buried down. within, and they
Yes.
don't really learn to use the power that they have to be empowered. So that's what what I want to do with my non-for-profit and me as being a doula is to power women to be empowered,
Yes.
to utilize that power that they have to help them as a woman first, and then to be able to help their children,
Yes.
to help even the birthing process to be better.
Okay.
I believe when a woman is there to give birth to a baby and can do that within her own conscious awareness, I believe that makes them a better individual.
Absolutely.
You know, looking over my births, I know that to be true. I know my first birth was a C-section, and you know, it was almost as if I wasn't present.
Okay.
And by me not being present, that's how I seemed to be treated throughout my whole hospital stay,
Wow.
as if I wasn't present.
Understood.
I know my second birth was vaginal birth, and it seemed to be so much more different because by me being present and awake and aware,
Yeah.
they treated me differently. And that's why I started the support group so that I can talk to other moms and women to see how they felt during their birth. I never knew what an impact it was on me until I did go to Uzazi Village back in 2012 and signed up to be a doula. And we were all sitting around talking about our births. And I just broke down crying because I was like, wow, you know, in my first birth, I was just not present.
Right.
Because I was under anesthesia, I was out. So it takes a part of, it's something that is taken away from you
Right.
when you're not actively involved in your birth. And it takes away from you not only in that birth, but throughout your life process. So by me doing the support groups, we have women that can come and talk about, if you do have children, talk about your births. Because a lot of people have stillborns and they're not really acknowledged in the hospitals. They just brush that on off, and it needs to be acknowledged because a human being was born and that was a part of you. And these women go on keeping up with these birthdays and keeping all this inside and don't have any platform to really express themselves.
Okay. And I'm glad you went to that. Now, if there's a young lady or a young woman out there that may feel like they don't have any support, or they don't have anyone to talk to about, you know, their pregnancy or their postpartum, what would you tell them? And then just let us know how we can contact you.
Okay, well, we do have, yes, my number, well, I have Gifted Hands, Talented Minds, Perinatal Services, and our phone number is 816-616-2652, and my email address is ghtm4254@gmail.com. And also the Uzazi Village at 3647 Troost is also a perinatal organization that helps women who are in need of a doula, breastfeeding support and counseling, and also if you have had a stillbirth or any type of loss, they can put you in touch with the right people. But also I'm doing those support groups there every second Sunday.
Okay.
From 3 to 5. So we do have that perinatal and women's support group available for women who feel like they don't have anywhere to go or talk to anyone.
Great. And is there anything that you would like the community to know, or anything that you just wanted to, you know, get out there to anyone?
Yes, we're going to be hosting our second baby shower on December the 17th. So if anyone knows of anyone that has any types of funding that they have available to help us with this endeavor, we will greatly appreciate it. And my information that I have aforementioned earlier, that's where they can get in contact with us to help us with that project.
Awesome. Great. Well, ladies and gentlemen, we want to Thank you for sharing your time with myself and Miss Ragland. So once again, she's doing, awesome things and great things for the young women. For anyone who may be going into a pregnancy or going into labor by themselves, you've heard it here on What's Up Kansas City. So reach out to her, get in contact with her, and for more videos, just get back with us at whatsupkansascity.net. And remember, if you don't grind, you won't shine. If you don't work, you won't eat. So let's make it make sense. Thank you.
I'm IFBB Bikini Pro Cat Williams, and when I'm not working out in the gym, I'm searching the web on Cascade Media and What's Up Kansas City. So make sure you check them out.